For the panelists open forum, let me call on our youth director and Rotary Club of Banilad Metro President-elect Eman Mendoza Hernandez, and interactor Science High Cebu President Adrian Campugan.
So may I ask our dear Chancellor, our Charter President, to start the ball rolling with a few questions.
For our first question, this is from one of the interactors in Science High. So, Lian Isabella Chan. And her question is, most of the people learn about mental health, not because they were taught to them, but by the right people, but they learn about them after they go through mental health struggles. Why do you think mental health topics are still not instilled or taught in as early as primary curriculum or even high school? And if they were taught in high school, they're not given as much importance or thought well. Do you think they should be taught in schools and at home, sir?
Exactly. In fact, that is one of educating, as I've said when I opened the topic, educating the next generation is really the key of changing a culture. Then you'll see I use the word culture and I end my statement with a culture because it's not easy to change a culture. It's embedded in us over time. So there is nobody that's on error. It's how we view things are. So moving forward, I would say it is a very wise idea to say that yes, mental health should be one of those that should be incorporated in the curriculum as early as elementary years, because we don't see them objectively. The person who's anxious and depressed felt it. If they don't express it, nobody would know. So what is some of my effort though in acknowledging that fact? In fact, I have conducted in Region 7 through Dr. Orticles as the director of DEX, training in training the teachers in identifying kids, children as early as elementary about symptom of depression. That's one. And why do I hit on the kids and Region 7? Because of their long history also of the Ormoc tragedy and the lot of tragedy, the natural disaster they have that even until now has been experienced as an as an outcome. Second, what I did in 2017 when I went home, my very first day, I went to a seminary somewhere in Tayud, where there are some seminarians there or some priests, and I presented the same presentation. My hope is not to change a culture. My hope is to acknowledge and to teach these priests, who is mostly, interacting, because we have a culture that when somebody is depressed, we go to our spiritual guidance or counselor. My hope is to educate these priests that somehow if they go there, they would not, of course they should say this, but they will not only give prayer as the only option. In fact, they would say, pray the most you can. At the same time, go to your doctor. And if you have to pray that you end up in a good provider, a good doctor that can treat your depression. I think that's the beauty of it. And it's good that if we educate these people, that people run to, or where do they go to, then they could direct to the right care. That's educating and also spiritual leaders in our community. I think that's the good background. Yes, I do agree. We need to have that in the training.
Yeah, thank you so much, Doc Rhigel, for clarifying that. Just to echo what you said, I was very fortunate many years back that my spiritual director, when I was still studying in college, who was a Jesuit priest, also did the same thing, that approach. He counseled me spiritually, which is a very distinct aspect of of being a person, but also distinguished that there's also a need for me to see a mental health professional at that time.
Yes. And that's just a simple goal that we have. We should not deny our prayer and our faith. We should complement faith with medical practice and science.
Someone just messaged me, Lian Chan. Okay, Lian Chan, you can present your question live to Dr. Tan. Please, Lian Chan.
Thank you, Adi. My question, Doc, is what is one thing that the popular media has advised people with mental health issues or taught people to do for people with mental health issues that you don't personally recommend?
What is a social media that that I don't recommend, right? Is that
Mm,
right?
like, uh,
Okay.
what is popularly advised?
I would say the concept of depression, sadness, and thoughts of suicide is a sign of weakness. That empowerment of saying, if you think negatively, you have to think positively all the time. The reality is, there are times that you will feel negative. But if you just in social media or in any other means of media that you will just cover it by saying, just think positively. I mean, it's good to think positively, but for people who are really depressed and have symptoms of depression, telling them to just think positively does not help them at all. It puts them into an activity that they are wrong, that they should not feel what they feel simply because of the culture of being positive. Well, I think the culture of being positive should be directed to the culture of not acknowledging, should be directed to the culture of acknowledging the feelings and the positiveness of what you do is to look at what you need to do to seek help. I think that is what we meant by think positively rather than covering up what you actually feel. The bottom line is, if you are really depressed and you're very suicidal, make sure you acknowledge how you feel. That is the very first step of overcoming that emotion. So don't just cover it by saying, think positively, because if you're clinically depressed, it's denying your real emotion.
So we've seen and heard news about fellow students from different schools taking their own lives due to circumstances in connection with this pandemic. How do we reach out to other students who might secretly be feeling anxious and depressed, as well as prevent ourselves from experiencing depression and anxiety, especially nowadays where circumstances brought about by the pandemic have become a lot more depressing?
Exactly. And that's the reality. And if I have to summarize what we need to do, I would say normalized that feeling. What do I mean by normalize that feeling? We are in a pandemic, and in a pandemic, it is an abnormal situation. And because of that abnormal situation, it may perk up abnormal reaction. So therefore, your reaction to an abnormal situation, which is out of your norm, is a normal reaction. So normalize it, express it, share it. It decreases the impact of how you feel. It is when you feel something, what you identify as abnormal, in an abnormal situation, that you kept it and you don't talk about it and you don't normalize it, that it becomes a pressure. And then later on, it can affect your decision making and it might be too late. Remember, in the pandemic, it is an abnormal situation that may perk up an abnormal reaction, which is a normal expectation. Share it, express it.
Thank you
All
so
right.
much, Doc. Thank you.
Adi, you got a really good there, a really good answer. What do you think?
Um, I can always reflect fact number 5, I guess, if I may.
Mm-mm.
I can still remember fact number 5 given to you, given by Doc. So like the youth are the most common, like, or most commonly share their thoughts, feelings, and problems to other youths, which is true, Jud. Like true, Jud, Doc. Like we need social support from other friends, maybe not from our family. Okay, we can't really express how we feel and what we feel towards them. So basically, all we have to do is to be open.
Yes.
Mm.
So that's really true. Youth relates to other youth. The concern is if the parent or the elderly people who's with the youth is not friendly enough in their approach to the youth tends to isolate. And the problem is when youth express to another youth, it's good. But the problem is other youths don't also know the intervention to do it, right? They might
Right.
be on the same boat that is now drowning the whole situation. It's good to express. However, it needs certain guidance and some level of maturity to guide somebody to create a difference in their intervention to take them out of that feeling.
Right. Thank you for the clarification also, and the empowering words also, to make sure that even from both sides, that the youth seek proper help, but we also educate each other to
Yeah.
to know better about mental health. So we have a question here. There's a question here on the chat, privately sent. Please ask, should you be concerned for a person who makes self-talk? Okay. What's your thoughts on that, Doc?
Self-talk is very healthy in a sense that it affirms how you believe. It gives you a chance to self-assess yourself. But it should not end in talking to yourself. There is such a thing in education and academia that you speak out your own thoughts, to hear your own voice and your own perception, so you will know where you're at. And it's healthy to do self-talk, but make sure you don't only stop at that point. Self-talk allows you to know your strength, your weaknesses, your fears, and your emotion. But then do not stop only by talking to yourself and affirming to yourself. Share it appropriately, especially when you start your self-talk and you notice in your self-assessment, self-introjection, self-inspection, and you talk about it and you notice that where you're at emotionally or behaviorally affects your relationship, affects your job, affects your day-to-day activity. Self-talk is not enough.
Wow, very, very powerful that, you start off that it is healthy, but it needs to be supplemented, so to speak. Mm-mm.
So, so
Yes.
true.
We have a question from past district governor, Doug Vincent. Please, or rather, yeah, there you go. Please comment on the effects of social media on mental health issues. I think that's a very relevant one.
Very, very timely and very, very significant. Social media is everyone's own opinion and perception given to the public or to another individual. In the field of academia and science, perception and opinion from one person expressed directly, indirectly, or any form of media, and the most fast in social media now, it's so easy, it's only the click. That's why you have think before you click, because that opinion, that perception directed to a person or to the group of person doesn't have any academic value. So you have to be very careful in believing and emotionally absorbing comments, opinions, suggestion coming from somebody given to social media. It might not be directed to you, it might be generally posted, but you have an option to put value on it or just browse of it as fun. You have the control. You have the choice. Your choice is to invest your emotion on something that is an opinion of others or make it their own expression and move on. It is very impactful. We cannot control anybody, what they post and what they talk. In fact, it would open up even the discussion of bullying if it's directed to you and shaming you. But remember, bullying and shaming in social media, in posts, in pictures and words is mere opinion of somebody who are also charged in their own thoughts. It's never a good measure of who you really are, and who and what you can do as well as your strength and weakness. So take it as a grain of salt. If somebody would bully you, remember, it is not a good picture of you alone. It is their opinion of who you are. Brush it off, move on, and have fun.
So we have Jessa Manigos. Jessa, she wants to volunteer to ask Doc.
Yes, I thank you, Adi. Hi, sir. I've been wondering for so long, but I just want to ask if it's possible for a person's mental health to improve despite staying in the same environment that caused the same problem.
Is it possible for a person to
The person's mental health to improve despite staying in the environment that caused the problem.
It is very possible. The progress might not be the way we want it to be. Because remember, if you are in the same situation and you cannot get away of that situation, you have the power to change your perception of the situation. That alone can give you that idea that even if you are in the same household, in the same people who actually belittle you or look at you very, very without respect, and you are dependent to them, you know. So then there is a theory of the diathesis theory in mental health. What is the diathesis theory in mental health? It tells you that if you are in the same situation and you view yourself as a victim, then you always feel as a victim. But given into same situation and you get out from that victim mode, then perhaps you start to look at what are your strengths to grow upon in the situation that you can never change. That is a potential growth. So now it's up to you. If you don't have and you're helpless because you cannot get away of that situation, train your mind to look at a glass half empty or half full. Look at your situation as a challenge where you could grow rather than play the victim. That is perception. And that would direct your goal.
Thank you so
Thank
much for
you.
that, sir.
Thank you also, Jessa, for that question. I hope you're satisfied with the answer. Sir Eman, do we still have questions, or I'll be entertaining these questions from our interactors?
Sure. We have someone, I believe, who raised her his or her hand. I just saw it. You can entertain it for us, Adi. Nawala.
Wala
Okay.
siya.
In
Okay,
the
here's a
meantime,
question
okay, go ahead. Go ahead.
from Mary Abigail Paniares. So her question is, mental health is an especially taboo subject in our country. What steps should we take to have more unashamed conservations about mental health, sir?
What was that, the last statement?
Um, what steps should we take to have more unashamed conservations about mental health?
So one, I would believe, I'm an educator. So my approach in life is educating. So I would say, and I do believe that the very first step, although it's taboo, it's a culture, it's so hard to change, but I think the baby steps we can take is educating the public, and educating the public in terms of community discussion, like town hall, what we do right now. Although it's online, but it actually reaching out young minds. That's one. I mean, common discussion is already an education, and hopefully those that listens and believe and work on it can also duplicate it to another person, and you have the ripple effect. So that's one, education in the community. The earlier question of incorporating this in school, make it a part of academia in health, right? Health education. And in health education, then we incorporate mental health discussion. You know, that's another way of turning and making it possible change slowly coming from the grassroots. And lastly, even in family, a constant reminder of making an opening and talking about depression and mental health care being, as I've said along all the way, normalize it. Talk about it. Kung hilantan bitaw ka, may magkainit ko, why not karon? Unsay tan-aw nimo? Depressed ko? Why not talk about it? And then talk about it slowly. The next generation perhaps will normalize the process that it is, after all, part of your being. That if you don't take care of it, just like your physical health, kung di ka mag-exercise, manambok yun ka. Kung ikaw, di ka mag-express sa imong feeling, ma-depressed ka. So it's the same thing. Normalize it, talk about it. But the cornerstone, I believe, is educating the public slowly. It takes a generation, but the generations should start now.
So, Doc, in mental health issues, Doc, just like any other health issues, we also encounter emergencies, Doc, like breakdowns or panic attacks, like from our friends, Baron, or family members. And are there any psychological first aid techniques, Doc, that you think everyone should know, just like how everyone should learn CPR or the Heimlich maneuver?
That's very good. That's really grassroots. I like that. Yes, there are heightened emotion in certain ways. Anxiety, depression. What you want to do is, as long as when that happens, make sure you are in a safe environment. Walay sunog, way mo buto, way gas. But when that happened and you have a heightened emotion, make sure you let the person be in a quiet, or bring it to a quiet, private place where they could express it out. If gusto sila manumbag, pasumbaga sila, pero ayaw diha nimo, o ayaw sad sa bongbong, pasumbaga sila sa kutson or pillow, because you allow that emotion to express without harming self or environment. Right? So samiyan mong sumbag, ay lang ko sumbaga, ay lang sana kay masamad man ka kay musumbagon ang bongbong, but there is the kutson, hala sumbaga na pag-ayo. And I remember working in a hospital. That's one thing. Working in the hospital as a nurse, it's a very heightened, especially when I was in hospice care. Daghan kay namatay and you were there, right? We have in our nurses station what we call as a dumb it doll, where it's a doll that if you're really getting frustrated, you could get it, you could go in a special room that's quiet, and you could pound it all the cast word you want so that you express it out. That's one thing. When it comes to really heightened that you really cannot control a person, I don't know how's the system there in Cebu. You call 911. I don't know if we have 911, but you call medical help, or at least bring this patient to a hospital where they need to get medication. So those are those avenues. Remove them from high stress, high risk, life-threatening situation. Let them express it out in a way that it does not harm self or others, but allow them to ventilate and debrief. Let me tell you one more story though, very, very quick. I have one patient who came to me, and she is a young 24-year-old. I know she has depression, but she has also bipolar. One time she came into my clinic and she looks so nice, so prepared, with makeup on. So I greeted her, and then she says, I even acknowledged the way she dressed up. I know it was a different look from when she was very depressed. So then I said, oh, you look so nice. Is there anything special? And then she says, yes. And excitedly, she was smiling. I said, yes, I'm on my way to the airport, and I have 4 friends waiting there. So I said, well, good. What's in the airport? And she says, I'm going to the trip of my life that I dream of. And this is where we're going. And she says, going to Paris, France. And I said, wow. And then I asked, so what's very significant in going to Paris? And she says, I made my reservation already in the top of Eiffel Tower. And I said, wow, that's great. That's a really great dinner. And then I noticed when we were talking about that, her face dropped and look at in the floors. Then I noticed it right away. And I said, is there something you would like to share about that reservation in Paris, in France, at the Eiffel Tower? And she says, yes, because it has always been my plan, and this will now make a reality. So then I said, I'm interested, your plan. And she says, I'm reserving it there because that is where I want to commit suicide. It really caught me unaware. And I said, the only worry I have is when I do it and I ruin my 4 friends vacation because I will commit suicide there. So then I said, would you allow me to help you? And she says, how? I said, I don't think it's good to go to Paris right now. I would suggest to bring you to ER. And then she was quiet and she nodded and she says, I guess so. So then I called 911 under her permission. So what does it tell me? It tells me that she was so determined to go there, but in her last effort to ditch the plan of committing suicide, she was wanting to know if somebody is interested how she feels. And it's her last effort to reach out for help. Good, I was able to pick it up and we talked about it and she agreed and she said, that's fine, Dr. Tan. I'm the only one. And I said, I cannot let you drive to ER because you're the only one driving. I have to call non-emergency 911 to transport you there. And she says, I think you're right. If you were not talking to me or bringing me to ER, I could have done this. And I planned every move already. Well, her dream of going to Paris never happened, but at least she's still alive.
Very much so. I just recall from the past, like I just wanted to scream out, "Someone save me," but I just couldn't vocalize it that way. And
Yep.
as mentioned in your talk earlier, and again now, it comes in different forms. And being attentive, and I love how it was mentioned earlier, the first aid, yeah, mental health first aid. That's pretty beautiful. Thank you for that. Adi, we're gonna wrap up with the last two questions, I believe.
Yes, sir. We are down to our last two questions this morning. So for the second to the last question, we have a question from Kenya Comeros, one of the interactor of the Interact Club of Banilad Metro Science Cebu. And her question was, why has our country come to the point of cultivating so much voodoo and stigma on mental health? Can the environment around us, especially the youth, be affected by this subconsciously?
Ultimately, it affects the next every generation. If we don't change our culture or our view in mental health, and we kept on the culture of stigmatizing mental health rather than making it a real illness to be treated, the next generation is still going to be in the same fate as what the generation of today. That is an advocacy. Culture is not easy to change, and culture is not overnight formed. It is formed over time. It's nobody else's fault. It's a contribution of different factors, different beliefs, and different perception. But we cannot live with what is now to change something significant in our life. What we can do is move forward, create a different perspective, and in this case, make mental health a normal discussion and believe that mental health is a real illness, just like any physical illness. And hopefully, the next, if not this generation, the next generation's generation may probably slowly change a culture of what we have lived for hundreds of years.
Okay, thank you so much, Doc. Okay, for your last and final question for your ginoong healthcare provider for this session we have here. It's important that we need to accept how we feel and validate our emotions. So for your final question, when is it okay not to be okay? And when is it not okay to be okay? No.
When is it okay not to be okay? And when is it not okay to be okay?
Yes, Doc.
I would probably say be true to who you are. It is okay not to be okay. And it's not okay to think there is perfection. Be who you are, be true to who you are. That is true to how you feel. And it's okay to express even the most fearful thoughts you have. Be in control. That brings you a good quality of life. It is when you give in to the expectation of others that the concept of okay and not okay. Do not seek approval. Seek your own will and your own happiness. You define your own fate. believe in yourself. And it's okay to be not okay if you are true to who you are.
Beautiful. Thank you so much, Doc Tan. I mean, it's not the thing about being a doctor, and you've expressed it very well that it's not just something that you work with or you work on, it's a vocation and a profession. And thank you for being a medical professional that really professes the true values of health and service. So just to give a quick recap and some insights, so I've been taking notes. We have to be attentive and do not hide the things, the mental health issues under the rug. We should acknowledge it. We should normalize and educate others with it, and also seek professional help because they're trained for this and they have experience. So it's a combination of theory and practice for them. And then, so especially now, treat social media with a grain of salt. Maybe you can detach yourself a bit from it and don't let yourself be overcome by social media. Everyone's going through it, so I think it's a very important advice from Dr. Tan on the social media. And then stop, look, and listen. Yes, I think that's very important to pay attention to our friends and loved ones, especially when the moment comes that we notice, hey, this person might need our help, especially in terms of suicide, depression, anxiety, and other mental health issues. And then I love it when he said, Doc Tan said, suicide is preventable, right? All right. Suicide is preventable. And then let us, as different generations here, we have multiple representations of generations here on the Zoom call, from the baby boomers all the way to maybe even alpha. So let's change the culture together to form a better, equitable, and a happier society for everyone, especially in the realm of mental health. So daghan salamat, Dr. Tan